that over. Call us to order the Self-Insurance Board meeting on 16 April at 10 o'clock. We'll ask Brother Merrill if he would lead us in a word of prayer.
Father, we thank you for the start of a beautiful day today, and we praise you for your many kindnesses and blessings to us. And we pray that whenever we see those valleys, that we know there's a mountaintop. And we just pray, Lord, that you'll be with us today, guide and direct us, and direct us in the affairs of this county. We pray in thy name. Amen.
There was not a sheet put out, but is there anyone that would like to speak from the public? Okay. Yeah. Approval of the minutes.
We need to do the agenda.
Okay, there's the, okay. Okay. Have a motion to.
So moved.
Second.
All those in favor?
Aye.
Approval of the minutes.
I'm going to abstain because I wasn't on this committee.
Okay, I'll second it. All those in favor?
Aye.
Okay.
We're going to have, if I may, we're going to have to carry the minutes over to get ratified at the next meeting, because that's not a positive vote if we have one abstain, because we only have 3 right.
Any vote to form of it on?
No vote's going to carry anything if it's not a
Can he
majority.
not vote, just,
Sorry, yes, he can vote as to form, yes, I'm sorry, I thought.
Whatever's easiest for this committee,
If you just go to the form of the minutes, not the subject matter that it was.
Okay, yeah, minutes. Okay, so we can carry that over, it's no problem.
whatever you all want to do.
But like I said, we do have the quorum and we do have voting.
Yes,
Okay.
as long as it's.
Otherwise, we don't need to be. Okay. I have no report. Commissioner Boyd didn't give me anything to talk about, so, report from the consultant.
I think we're going to let one-to-one go first, because they have another appointment to get to.
I have to go to the road, Kelly will stay for the whole meeting. All right, so everybody has our, clinic utilization remains really well. For the first quarter of the year, we had 838 visits just for government employees. The next chart below kind of shows the top visits. Walk-ins were very well utilized, as well as behavioral appointments, and then you can see the remaining appointments down below. We had 227 virtual visits for the quarter, so that would either be telehealth, text care, but any of those avenues where patients came into us virtually to be seen. And then patient satisfaction remains very high at 98%. On the back page, I just kind of wanted to share a summary of the mail order program. So last year, just everybody's aware, we switched some medications. So in the clinic, we dispensed generic medications to patients, but we added mail order last year, and we added to that a bigger formulary. So not just generic medications, but brand medications also. And we did a cost comparison to identify those drugs that were cheaper to go through this mail order program versus the plan. And so we have saved a total of $40,000 last year by making that switch to some of the drugs. Brittany can chime in on that too, but she was very involved in that process.
Yeah, that's an actual comparison of your drugs as to the cost of marketplace versus going through that program. So, yeah.
Let me ask you a question. How do you determine which generic drugs that you guys are carrying? That's my question. I mean, I've had a lot of people ask me, and I don't really know. We can only cover the ones that's profitable to the county, but we don't have a list of what you'll cover.
Yeah, I can see the list of what we cover in our clinic. So basically, it's acute medicines, antibiotics, that kind of thing for acute issues, and then maintenance medications for certain diseases like high blood pressure, cholesterol, diabetes, those kind of things.
Send us a link or a list, and we can put it on the finance website, because a lot of people, I don't think, is going down there for maintenance drugs and other things because they're not aware of which ones are and aren't carried, and they're not willing to go to their physician and one-to-one to get the maintenance drugs. I've heard some comments.
Sure.
I think that would be a big selling point.
And is there a separate list of formularies for what's in clinic versus AS? No.
Yes, okay, and I think that formulary, the mail order formulary, is already hyperlinked on our website. But we can get both on there and then send you the link also.
So you have a group of mail order that's different from the group that you carry in the clinic.
Correct, because mail order does include some brands that were cheaper to go through this mail order program versus.
Well, there's brands, but there's also classes of drugs. There's groups of classes you don't carry to. Or,
Right, we don't carry controlled substances.
okay.
Yeah, there's certain classes that we don't carry.
Okay. So if they get a prescription from their doctor, they can go in and pretty much anything that you carry and get it filled.
Absolutely, as long as they bring us that prescription, absolutely.
Okay. And then the other one, I hate to keep bringing it up, but the other one, there's some questions about people that want to do labs too. I've asked a couple of times too, they're not sure of where to call in or send stuff if they want their doctor to do the labs through the pharmacy.
Through the clinic.
Yeah.
Yeah, they just, same thing, bring us the lab order, they can call, they can text, and we can let them know if the labs on that list of the doctor order are on our approved lab list or not.
Is there like a flyer or something we could put on the finance website so that employees would know the way they, I think that would increase your utilization on using the clinic's labs versus the doctor's labs, and I think we save quite a bit there, don't we?
Labs
Don't we
is
save a
always-
whole lot? Yeah.
Labs is always
So if they use if they use our drugs and if they use our labs, it saves us a considerable amount of money if we put the flyers on our website. Because I was going to use mine for the labs the other day, and I had to go figure out how to do it and call, and then somebody asked me earlier, and I had no idea.
Labs is, and medication too, but labs is a little more confusing sometimes because doctors order a specific code, a lab code, and that description or code may not always match the one we have, but we might have one that's very similar, so it might be difficult for patients to figure that out without a call to us.
Can you carry an order from the doctor, or do you have to have it sent to you guys? Which way is everybody?
Either, they can do either.
We can do either one, so I can have my doctor write me one, or have them to, I think it's fax, isn't it, or email?
That's right.
But if it's similar and they call you all can talk them through that. But actually, yeah, they may have ordered one little thing, but if we run a full panel,
And
it's
honestly,
still cheaper for us to just do that whole
and
panel.
really the easiest thing is just text us a picture of your lab order to our clinic phone number, just text it, and we can look at it and text you right back and say, yep, we can do them all, or we can't do this one.
So I think we get a flyer with the drugs that you cover, mail on regular, and one for how you carry an order. I think it would increase utilization because there's some questions that keep coming up about that. People just aren't aware of how to do it easily.
Yeah, I think we just struggle in general with communication to your employees. The other, we're gonna get further on into this, and I've included an X-ray flyer in the presentation, but your folks are not using X-rays. Board of Education folks are blowing it out of the water. I just don't think they know that it's available, so getting that out there to them also.
We put it on our website, but I think the issue is we don't have a countywide email system because we've got more than one IT department. The sheriff has their own, and then we have the main one, so it makes that group difficult, but I think they're trying to combine them.
I've sent it all out, and I've sent it, or put it on our website, and I hand it out during orientation.
And maybe we look at like, if our team can go make some side visits, like, can we go to the sheriff's department or the highway department, or wherever your big populations are, and just have a few minutes to talk about them?
And I think we've got the flyer already up on our site for the X-ray rep, but for the drugs and the other one, and the other thing that may have somebody call us, we tell them it's there, but.
Yeah.
I mean, that's the issue we have county because we're so spread out and the school's more.
Well, I think a lot of people just don't use their email here, right, like we're.
We've been told
They're
that.
in all day long.
We've been several departments don't check their email at all, and they're supposed to. They even have policies to check them, and they don't check them because they use things like HRAs.
Right.
I don't know what you can really do to, but I think putting them on our website will help, and we can refer them to that stuff at least. If we can get a flyer for those other two.
Can we hit that hard during open enrollment as well?
To pass out the drugs.
Yeah, I can add that to everything too.
I think if it was open enrollment, they have flyers hung up for the drugs and pass out for the
Do
drugs.
you guys go on site for open enrollment?
Well, we don't, but,
USA will does.
Disabled does, and that's a question, can we ask them to carry the flyers? Sometimes they're
Or
willing
we
to.
can go with them and just have a separate table that talks about one-to-one while they're there.
Because I think if you gave them flyers with the drugs covered and the pharmacy and the X-ray, it would save us quite a bit of money.
All right, perfect. The next page, the wellness program. So for 2023 compliance, we had 388 employees who were compliant, who participated in all things, 173 spouses, and 4 wellness program dates, and again, the benchmarks are there as well, but really on track from last year as well.
What was the basis for a lot of
23 is the final date on that.
smoking or?
I would say that's the biggest.
When's the final date?
For 23, we're already done with it, I just got the information.
So we're finished with it. So we have 252 non-compliant.
Oh, yeah. Which again is really close to our numbers last year, we're trending about the same here.
A lot of those are the smokers that don't.
Yeah. And then the X-ray program's the next page, so again, we've kind of broke out the utilization from December through March. Again, we started in December of 2023, and as you said, we usually help promote the service, and that would be very helpful. I do want to share that through having X-ray on site, we've seen a few things already. So people are using us for visits they would have gone to that urgent care for. So that's definitely a good cost shift because we have X-rays. A lot of times people before, if they thought something was broke, would just immediately go on to urgent care. Where now they're calling us and saying, hey, can we come on in for an X-ray? And we did really early on in the program diagnose hydrogen-thorax, which is a very serious condition with fluid around the heart and lungs. And because we were able to catch that early with X-ray in the clinic, we were able to get that person to the hospital for a shortened inpatient stay because we caught that early in the process. So I do think it's been very beneficial and will be impactful as we can get that word spread. Along the lines of X-ray, we met with Board of Education a couple weeks ago, and like I said, their population is increasing widely, and so they want to look at expanding X-ray to Portland also, so that it's more available for across the county. So we're supposed to meet with their maintenance team next week and kind of look at space. That clinic is kind of at max capacity already, so trying to figure out where we would add that in the clinic in Portland, but just wanted this committee to be aware of that, and if it's something that you want to consider partnering with anyone like you did last time, please let us know. We can work around that.
Mr. Chairman, since they're gonna have to leave, is there any way we can talk about item 5A, because it's the insurance on equipment at
Yes,
1-1?
well, I was trying to get down to that point too.
Yes.
First of all, let me understand, what is the relationship of 1-to-1 with the county? What are you a private entity that works with us, or?
I guess it would be a vendor to the county,
Okay,
right?
the insurance is what I was concerned about, you know, being that you're co-located with schools, okay, and the school insurance was going to cover your equipment, correct? Okay.
So we kind of talked with the Board of Education, but essentially they got an equipment list from us, which includes X-ray machine and Ellis, to make sure it's covered on their insurance policy. So we don't physically own any of the equipment or anything in the clinic. You and the Board of Education own them jointly. They own 84%, and you own 14%, or whatever the split out is, right? That's how it's all passed back through to you guys and how it's all done. So we don't own any of it, and we just live in the space that you all provide, which at this place is currently the Board of Education.
Have that equipment.
Yes.
Wow, you know.
But they are carrying all of it on their insurance, so you all, I don't think.
Ms. Breff, I can clarify that. It's our understanding on research of this that the Board of Education was not insuring anything since inception. So we've gotten, if I'm wrong, tell me, but we've gotten notification that they will now, in the next budget cycle, get the insurance for the equipment, but the statement that they've been covering it, I don't think that's accurate, because I don't think any of this equipment has been covered by insurance.
So when will we know? Well, I mean,
Well, they
at least it's covered now, correct?
No, it won't be covered until it's part of the next budget cycle. So we're talking about July 1. Yes.
Is it not possible to contact either the schools or the county's insurance and have that endorsed on the policy immediately?
School board's gonna have to do that.
Pardon?
The school board's gonna have to do that. That's what prompted all of this, was to get them to either give us carrier information or to make sure the stuff was insured, and that's school board's response.
That's not a good response. I'm
I
sorry.
don't disagree.
I'm not trying to take sides, I'm just saying.
It's just, I've got
make a call if needed to bridge the gap or whatever, just let us know, but we just wanna tell you, the consultant, that not doing something is probably not a good idea, regardless of who's making that decision. We would strongly advise against not taking action on this.
So would it be a cost split, if we decide to run it through you guys, it'd be a cost split and you guys would insure it? Because they don't have insurance.
They don't insure it.
They don't own it.
Well, we have a joint ownership between.
She said 84% for the school. Yeah,
I'm sorry.
16% for us. So mainly it's on them, but still, we give them money. It's on us too. So this is what
And I'm gonna clarify too, because I was not under the impression that they weren't gonna cover it until next year. I was under the impression that they were gonna cover it immediately, so I'm not clear about that also.
Just got the response yesterday that it's gonna wait until July 1.
Yeah, I didn't get that.
Yeah. I would have been more.
If there's anything you need me to help do, and then let me know.
We can insure everything. Yeah. So we can't insure equipment that doesn't do it like a renter? Or technically, you a renter or an occupant, we can pay rent. We only got 16%.
No, it's fine. We just flip-flopped on you, and you're like, I don't know what. Okay, so good. I do want to just, to bridge the gap with what she was talking about with urgent care, so just so everybody understands how claims work, because I've talked to many clients, actually very recently, about how they think that urgent care and like Kroger or kind of what you might call a doc in a box are kind of the same. They're not. They are not. When we look at claims costs, they're not the same. So when we look at going to a little clinic, Vanderbilt has clinics often in like a Walgreens, that kind of a clinic, that is truly just a clinic visit, all right? Then there's urgent care. So America's Physician, something like that, or Fast Pace is another one. Those are actual urgent cares. Then there's the ER. So the urgent care is in between. We've got clinic, urgent care, then ER. There is a cost difference between that. So if we can get someone in a clinic, and then the only thing that they need is an x-ray, they can do clinic, x-ray, and then they're done, that we're good. Okay, so that's why it's really good, just like labs, if we can get labs to go through here, because labs are so expensive. So I just wanted to say that's why anything we can drive through a clinic, that's why you have a clinic. So that's my sermon for that part. Now we'll talk about claims.
That's why I brought that up, but there's no
Yeah.
way we could do any form of urgent care though. It wouldn't be.
No, and
Well, but now that your employees can text us 24/7, there's really no reason for them to go there before they text us. Because our providers, even if it's midnight, we have a provider on that will say, hey, ISAT, rest, whatever, and let's do your x-ray in the morning, or we do that seems serious, go on to.
But like on that, we usually, when you text them, because we've done it before, there's not an appointment open for like a week, and it's
So you don't need an appointment anymore. You just text and they immediately take care of it.
on the text, but if you need to see them, is there gonna be an open spot?
Well, they'll call you if you need a call, but otherwise they just treat you. So like if you say, oh, I'm not comfortable texting my condition, then they'll call you.
We called and text one, and I don't think there's any open appointments, so we ended up sending they probably could have been urgent care pretty easily over to the emergency room, and it was on the weekend.
We can, like, do that way, so I can research it, but like,
Yeah.
what we're supposed to be doing, and what, I'm in text care all day long, looking at the.
I'll get the exact details.
Yeah, you're supposed to just text in, and then there's a provider that will chat with you and recommend what best treatment is.
Right. They actually sent us to the little, it's actually an urgent care, that kind of emergency room, it's over there on the.
And if it's something that really needs to be seen right then, they might still send you somewhere if the clinics are closed, but it's good to at least run that.
They may have been closed because we did do the texting and stuff, and they sent us to the urgent care. My question, I thought was availability of appointments, but it could have been
All right, so this is our monthly report, and so everything, I did send this electronically. I do send this every month, even if we don't meet. So this is the March numbers. Remember, we get March because we are in April, but it's always, we're looking back a month. So this is looking at monthly and year-to-date change. Again, in July, we'll start over because we'll have a new plan. So this shows our total monthly income, expenses, and that monthly change. And then we also get to look at that year-to-date change. The last report was, there was a ton of income because there were rebates. So we'll have months like that where it just looks really, unprofessional term, wonky, because it's just a lot of income, or there's a lot of expenses, because maybe a lot of surgeries or something really big has happened on the claim.
Now, you're talking about the one that we have right here.
Yes.
In this.
Yeah. So
I'm wrong.
those happen, and so that's why we don't get too hung up in just 1 month. It's really good to look at that year-to-date, what's happening over the entire year. So that's why we do like to keep an eye on that month, especially if we keep having those red box. And that's why I do box it in red. I'm not trying to hide anything. I want you to know what's happening. So, but it was, again, you're in the black. And so for the whole year today, for this plan year, you're still in the positive, which is good for that. And that's medical and RX. And that's that involves clinics, that involves everything running through the Blue Cross plan, that involves us, that's all of that. Then on the other box, that's your dental, same thing, we're still running in a positive. That is almost an even exchange every single month. That has proven to be that way pretty much year over year, it seems like. And then if we look at the bottom, our large losses, as we get towards the end of the year, yes, these always seem to expand. I start putting people on this list when they cross over the threshold of $100,000 because we just watch them. That's all that's happening there. It doesn't mean anything's happened or that anything will happen. We've had a couple of folks who hit this list and they've already termed. Term means they've fallen off of the plan. Various reasons why that happens. So we have a couple of these that have terms. The highest person on this list, this is an expected person. They will continue to grow through the end of this plan year, and this person has been on the plan for a while, and I'll just continue to watch it grow. I don't expect anything catastrophic to happen with this person. It's an expected increase of $20,000 to $25,000 a month, and it'll start over again in July. It's an RX thing. And then
This year, the 300,000 is this year then?
yes, it's just this year. And then for the PEPM, that's the box that we really like to pay attention to because that's the per employee per month. And so that really likes to kind of absorb what's happening over the years. And so most health plans cannot say that they are holding at or kind of going down or going just a little bit up. Most are tracking way up high. So you're at or a little bit below what you were tracking at last year. You can see in 21-22, that was that COVID catch-up year. Everybody had a high year after that. So I do, on this line, I do separate out medical RX from the clinic cost just so we can look at it. There's not really a significance to that, but just so you can kind of keep an eye on that. And then also one small number at the very bottom left, that's the running county stop-loss fund. So in that medical RX cost, you all are paying yourselves for stop-loss insurance in case someone is to go over the $500,000. At this point, I don't expect it. Does not mean it won't happen. It could happen anytime. If there's an early birth, a NICU baby, it does typically take a NICU stay, a transplant, something very, very big that has to happen to hit something very high like that. But at this point, for this year, you have put, for this year, and since you've been paying yourselves, we're at $1 million in there. Only one time so far since you've been paying yourself have you taken a little bit of money out because you had one person go over that 500 level. Yes, sir.
Down there at the bottom where it has, dependent male, employee, female. I see a lot of duplication. What is the?
I don't want to tell you who it is, so we don't want to say, shoot. It just kind of gives you an idea that, hey, we've got a lot of spouses that are expensive, or, that's really all of it.
I thought that was a group of people.
Yeah, we don't want to, say that, Bob's over here charging the plan line, not that he's on
That's
look at spousal, they like to add money if the spouse is getting insurance somewhere else. And so when you want to add things like, sometimes people like to break up populations like that. So if we've already got it divided, we already kind of know, yeah, our spouses are costing a lot of money. It does kind of create that case. So
Retirees
that
cost
carve
a lot
out
of money.
Retirees, things like that. So,
It costs
Yeah.
a whole lot in this plan.
so, yeah, so this is the monthly report. I do it every month. So are there any questions on this report? I know it's still kind of new for some. I can move on to my other.
Let me tell the chairman what this is, because it wasn't on the agenda.
Yes.
That's the report for the equivalency, and it's a very long report, so Brittany can go over it, or she can email it to all of you, but the short of it is, to be in compliance with federal law, you really need to take those recommendations.
So I have a list, I don't know, I think it's 8 pages. I've typed out everything because I'm usually, I'm going to give you way too much information because I want you to be very informed about what's happening. So there were 2 different pieces happening. You all approved, it's been several months now. So we did the NQTL, which is the non-quantitative treatment limitations analysis. You all paid a group called PHIA, PHIA, to do the NQTL analysis for you all. This is a federal requirement. So if the DOL comes out, and they're probably not going to go, hey, let's go analyze Sumner County today. What they're going to do is say, we're going to go check out Blue Cross and everybody they insure, everybody they're the TPA for, and they're going to just go down the line and just start asking, do you have your analysis? Do you have your analysis? And all you need to be able to do is say, I do. So I sent that over to you. Did you get it? You remember getting
I can't remember, did we file it?
We have it.
Yes, we will
And
file
I sent it to Walsh. Did you get it? Did Legal get it? I sent it to you. I emailed it.
Did?
I did.
Can you say it's in?
I sent it after the email. Okay.
I'll send it back
Okay.
out, yeah.
I can send it again. I still got it. So there's an ACCL analysis. You need to be able to just hand them that. There are a couple of changes, but really you guys were pretty much in compliance with those NQTLs as best you can be. If they were to come in and do an analysis on you, there may be some things that Blue Cross might have to follow up with on some pharmacy analysis, but oftentimes it is very common that Aetna, Blue Cross, Cigna, whatever, they're not going to give you all the information that has to happen to do the analysis. This is very common because it's pretty detailed. And so there's just a couple of small things, but there was another thing you all also asked them to do, which was to take a look at your entire plan document. So if you've never looked at, you all are the trust for the entire plan document. So there is, that's your thing, there's a long plan document that you all actually are managing.
And it's,
And so, yeah, serious. So this is your whole, this is one of the 2 plan documents that you all are in charge of, okay? So this is just one of them. There's 2 because we have Plan 1 and Plan 2.
and the MDL, but it's not clear.
Right. So there's also addendums. But, so we have these,
Dental, I'm sorry, dental, there's 4 of them,
oh, the dental as well. They are
not as part.
not part of this, so they're actually not part of our problem. So we have this. Now, Blue Cross also has their, just their standard document that they use. If you were brand new to Blue Cross, they'd say, hey, this is the document we like to use, look through it, you know, this is what you are. But you are self-funded, so you can kind of make some changes if their legal agrees, and hey, we're good. So, over the years, because you've been self-funded since the 10 Commandments, I don't know, it's been a very long time. The 80s? Yes, okay. So, you've been self-funded a very long time. So, since then, you've gone from what was their standard in the 80s, and you have slowly modified it. You've done some changes that legal has required or asked for you to do, and you've put those in place. But there are some things that have just kind of stayed. And we've made recommendations, you've changed some things, you've put in a wellness program, you've done some things, but it was time for you to have someone else take a look. It's just an external group. Sophia also does this. And so we had them go through it, through your current document. It says both your plans are almost the exact same. They just looked at one of them, and they sent me an analysis that is long. And I went through that. I compared your current document with the Blue Cross standard document with the analysis, and that's what I came up with, all these things. Now, a lot of them are, hey, they're just requiring, or they're requesting that you go with something that basically Blue Cross's standard document covers. I think we just need to go with what Blue Cross has got on their standard. So let's just rework what you've got. It's not going to change the meaning of anything. A lot of times what legal just wants you to do is define something a little bit better. No big deal. And I think that most of, I don't know that actually any of it's really going to change what you're covering. I don't think really I think most of it is really just defining what is the Mental Parity Act? What are qualified medical child support orders? Things like that, because we referenced some things in your original plan document that we never really defined. And so FIA says, well, best practice says we actually define it. And oftentimes, Blue Cross's document actually does define it now. So that's really what all of this is. And I do have it all nicely typed out, and I will go through it bit by bit, and we can sit here for, we sat through it. I made Bob sit through it for 3 or 4 hours, I don't know, the other day, and we can go through all of these changes. I can also just send them to you, so you can go through them. I can definitely send them to you, because I know you need to definitely, legal needs to definitely take a look at what we're suggesting. Also looking at this standard document, because a lot of times I'll reference, hey, page 59 of the Blue Cross standard document has this well defined. I think we should just go with what Blue Cross says. Also, you pay Blue Cross to manage your claims and to have their legal look at things and to provide wording. So we really need to lean on that as well. So I came prepared with all of this today. So I don't know what we need to get approved by the trust today and how we need to handle that. I don't know the best way to go about that.
Does it change any coverage or any administration the way we're going to administer stuff significantly at all?
Not significantly, no.
It doesn't change any claims, but it may change administration a little bit.
There's one thing, I know there was one thing that was an NQTL analysis that had to do with eating disorders. We needed to remove and exclude services or supplies for inpatient treatment of bulimia, anorexia, et cetera, et cetera. You really can't do that anymore. It's mental health parity finding. If you're going to treat other disorders, you've got to
So that's something we're required to take.
You've got to do it. I mean, that's federally required. So we've got to be equal with what we treat physically, mentally. Same thing. Let's see. Also, the way that you all change, the way that you all treat stepchildren, we've got to change that. Right now, there's a financial requirement. We can't do that anymore.
We've mentioned that. I thought that was an issue earlier.
Not okay.
I think we talked about that over in payroll, that we think we've actually not been requiring that because we think it violates the Affordable Care Act.
It violates it.
So there's several things, to be honest, in our, that's why I asked you to have it sent back to this group, because there's a couple of things in our documents that we think violates Affordable Care, and we actually don't implement them. We don't make people do that.
Right, and that's never good either, because the first thing I do with any group, if you ask me, is it covered or should we do it, I say, what does the plan say? And if the plan is wrong, then that's a problem.
So children that have been adjudicated by the court, legal with that parent.
There was a 50.
Even though it was a stepchild,
there was a financial rule in there that was an old one where you had to cover 50% of their costs. That rule's out the window.
Yes.
For several years, so we ignore the rule. We just make them prove that they are the legal guardian.
Yeah.
If they are, then we didn't ask for any financial because you can't anymore, is my understanding.
Right.
Unless I'm wrong.
There's no financial requirement. They're a stepchild, and you've got to cover them. You've got to cover them.
So,
and honestly, the financial risk of that, because again, our job is to keep the plan healthy, because if the plan's not healthy, we have no plan. So children are really not your risk on this plan.
is there any way that you guys could get her to email that and have a meeting next month? Because
we probably need to just sit down and go over it ourselves.
Okay.
we're getting ready to do open enrollment in May, so if we could have a meeting in May to make sure it doesn't change when we have open enrollment in May.
It starts the 1st.
Of May, so,
We need to have some more meetings.
yeah, because we're gonna have open enrollment the 1st of May. I don't think it would impact our open enrollment, anything they're saying.
No, I don't really, again, I mean, the stepchild, that really is kind of.
We've been doing that correctly anyway. You just kind of, those those major ones we knew about.
Yeah, but I mean, some of the other changes are, just the way that words that we use, there's just language differences now.
But it would be good to have a correct EOB
Mhm.
for July 1, so if you guys met in May, got it back to Blue Cross with those changes, then we could have the new, when they print for July, to have the correct information. Because when would we have to have that to Blue Cross for them to make the changes for the July date?
Well, I know July is usually busy.
Yeah, I mean, if you can get it to me next month or so, we'll try to get them, but usually we don't have them produced by July 1.
Right.
It'll be like.
But the SBC, I don't know that it will actually be affected by these changes. The SBC is the blue document that's required by the government. I don't think it would actually be affected by any of these
But I think the
changes.
EOB would.
The full plan document would be, but I don't think the SBC would be affected.
But I think our
Yeah,
EOB.
just to clarify, that's not the plan document, that's the evidence of.
Right, yes, the evidence.
Yeah, that's what I'm talking about, the evidence
Yeah.
of coverage, we
Yeah.
have some of these verbiage changes
Yeah.
too, because
Yeah.
Yeah.
Right,
that's one we need to get out to the
Yeah.
employees as soon as possible.
right,
Because it does have the thing about the
right, but the
financial.
EOCs are never ready on time, like, they're never ready July 1.
But we can at least make sure we're following the requirements.
Yes, we can get you ready and that, yes,
And we strongly believe we are anyway, because stuff like that, we're actually not.
you're already.
We know they conflict with the law, we don't follow it.
There's nothing in there that's more restrictive than what we have now, correct?
No,
So,
it would be
even if somebody enrolled or there was some issue here, all we're doing is broadening the
yes,
definition, so they're gonna roll into it anyway.
Right.
So if we can kick this off a month, I'd prefer to do that
Yeah.
instead of blindly pass this and
Yeah.
find we've got trouble later.
And call meeting in May, they could.
Yeah. I can send you this, probably today, maybe you can go ahead and have it. Digest it.
Got the budget workshop on the 2nd and 3rd. Yeah, probably seven, yeah, I know, we're gonna, like I said, loading up May here. 7th of May, normally meet at 10 o'clock on Tuesday, so,
In May 7th.
May 7th.
Works for me.
Everybody good?
Yeah.
Okay.
10 o'clock, May
Let's-
7th.
Let's mark that date.
I think that might ought to make a motion and
Okay. I move that we need to square up these, regulations here on the 7th of May, 10 o'clock.
Second.
All those in favor?
Aye.
Aye.
Oh, you found it, yeah, it's number 1. Mine's my word and everything. Was you done with your,
Yes, I am.
Mr. Chairman, you start my report?
Okay.
Okay, if you go to page number 18 will be the first page of the financials. And this is going to mirror a lot with Brittany's report, except this is going to talk about the whole year to date, where we're at compared to last year. If you look on the right side, the first column, you have 19.6 million some odd dollars. Last year, your cash was $17.53 million some odd dollars in your health insurance fund. So you can see just the same number Brittany's showing you on the bottom. We've kicked up quite a bit of money this year on your health insurance fund, so it's running quite healthy. The actuarials given from Blue Cross are quite conservative, so we think that's part of it. Plus, we're having good claim years, does anybody have any questions on that particular number? And then if you go over to page 21, that's your dental plan. You had $1.37 million this year. If you look at the number to the right at the top, Last year at the same time was 1.2, a little over $1.2 million. She picked up a little over $100,000 in that plan, just like they were showing you. And then if we go down to page 25, that's your on-the-job. Page 24 actually is your on-the-job injury. This one right now you have $6.7 million. If you look at the top right of the top number, last year your cash you had a little over $6 million. You picked up some cash there. The only reason I'm looking at cash, we do have accruals, and these are accrual-based funds, but they're only closed once a year, so that means any claims on there, your runoffs over time generally haven't significantly varied, so your best indicator right now is your cash. And all your cash situations has improved somewhat this year, so it looks like you've had a good year on all your plans. Unless there's any kind of claim or anything, I'm not aware of anything out there large. Anybody have any questions on the report?
I mean, this may be just a stupid question. I noticed all these are estimated estimates. Is there any year-to-date
These are your
actuals?
These are the year-to-date actuals.
Okay, well, it says estimated.
What is it?
Keep saying estimated,
That's budgetary
revenues,
numbers.
estimated
What page are you on?
budgetary.
What page are you on? We'll go through that.
Well, I mean, I'm just.
Let's go over the balance sheet really quick here. Maybe that'll help. If you look at this page, it's page number 18, and that's your balance sheet. And what you got to remember is we're mid-year, so these balance sheet numbers will not close. So if you look to the right is your year-to-date, and the one right, the far right column, the one right beside it is your year-to-date change. Your first number on there is your actual cash at the end of February. The next one's actually a building or a drive-through window that's fully depreciated is your next item. And then you go on down, it's like the 19.6 is all your assets. And then you go down to your claims that we have out that we know of right now is like $4,000 some odd dollars and a little over $1 million. Those are actual numbers. When you go below those estimated numbers, those are your budgetary numbers that just run until you close your books. So I wouldn't really pay attention to those because they just knit together. If you take your $19.6 million, which is your first blue line here, the first one comes from the top, and minus out the second with a 1093, that's a minus, that'll give you an idea about what your net residuals are. But these are your actuals, and the books don't close but once a year, so we'll have your estimated revenues and expenditures. Now, the very last pages, when we go into premiums, we will have budgets, and they are all estimates and actuals. But these should be as actuals we got through the month of February. And when we close at the end of the year, all these estimates will distribute your close against all your budgets and fund balances. These are your actuals. If that helps, Chairman.
Okay. Include your report.
Oh, that's into my report, sir.
Under old business, we've already talked about the insurance coverage on one-to-one Bull Run dock.
Yes, sir. If I may, we're still trying to figure out where this alleged dock that the county owns is located. I've got feelers with Marshall through the planning and development. He's got some contacts with the Corps to see if we've got anything of record, because when you've got adjacent property to a lake, it's really not ownership. You're doing a lease because the Corps owns the property, and I have not had any kind of response back from them, so I'm still unclear on where this alleged dock is.
How did it come up?
This came up at a meeting. What were we?
It was a meeting before, last scheduled. Terry, I think she was the one that brought it up.
We think we own it all. Where did she get paid?
I don't know, she didn't say.
I know we get paid in lieu of taxes from the Corps for a dock or a levy down in Hendersonville near a park, but I don't know anything about the dock. I do know we have some kind of involvement in it.
Well, she brought it up, I guess, and I'm just trying to answer that question. I just unfortunately do not have an answer yet.
I don't have anything on file. I'm aware of the dock. The sheriff and the GIS thing.
But that brings me to the next one here. I thought we were going to try and get a listing of all the property and find out exactly what is insured and what is not insured.
If I may interject on that as well, I've just come across a list of, when you gave it to me, it was, what was the
list of property that you gave me. It was called what was the report called?
I can't remember.
Okay, anyway, I forwarded it to Gen Ops, and I apologize for not sending it to this committee, but it had some properties on there, what they're being insured at, and I'd send it to Gen Ops in an attempt to make sure all the property that needs to be insured is being insured, and, I don't mind sending that same list to this committee as well.
And send a list from Sheets too. Jeremy Sheets sent us a
Safety
list
values,
too.
I'm sorry.
Jeremy has sent us a list of all the insured properties a while back, but I think right now, as Eric's saying, they're still looking and comparing it to our ownership list. But they do keep a list of them, and he has sent us a list with the values quite a while back. Actually, I think he sent us a link to a report was how we got the list.
I think I sent you a list of like all the information that I have, so you can see individual property reports and pictures that we have.
And we can have him send it again.
Yeah,
We can send it to him.
And if you find something that we don't have, we'll just go get it and add it to the list.
Can we just have Jeremy to forward that to the committee members, if that's fine, what you sent to us, and then CC me on it, and then they come look at it? That would kind of settle it.
If, since Jeremy's here and we're talking about that, and don't do it, budgets come to this committee, would it be good for him to give a really brief explanation of how those values are determined and what we do to come up with that data? Could you do that in like 10 seconds?
Yeah.
Yeah, no, it's, motion, suspend the rule.
Motion.
So, you tell me about a building or a dock or anything, I go out, or our surveyor goes out, surveys it, takes pictures of it, measures it, does whatever we need to do, and then we run that information through software that is industry standard, that uses real contracts within the region that are, or if I'm going to look at a courthouse, they will use courthouse contracts that they've actually built and compare and develop a cost for that building. Then I put that on the report, and then every year I rerun that information against updated values and send you guys a list of your buildings. That is the 10-second version.
I think the question we've got right now is, are we reporting all property to them that we own?
That's what the
So
question.
he's provided us a report, we have a fixed asset list, and I think Kim's got, Kim's also got a fixed asset list, but I'm not sure anybody, Kim's compared all those yet, I don't know anybody.
The list that Jeremy provided to me, which is the one that's been, sent through the process, is the one that I provided him, so whoever's asked for it.
Right, which I got a copy from Jeremy directly, quite a while back, but,
So everything's been accounted for,
that I've been
That,
told
that
about.
we've been told about,
Yeah.
okay.
There may be properties out there that we didn't know we owned, but until we're told about it, it doesn't get on the list.
Now, we're just talking about the buildings, because.
Buildings.
Not real property. It's not, not just land.
We're talking about buildings and equipment and stuff in the buildings, because it's insured too.
Well, we don't survey your contents.
We just give flat estimates for those, because we don't.
You get in the weeds on that, and you
Waste
wasting
time.
time.
My housing,
You spend quite a bit of money trying to
Sure,
insure the
stuff
thing.
for outbuildings on my property, I just couldn't believe.
We just give a blanket.
$100,000 coverage for outbuildings, and I only got a woodshed, a carport, a utility building, $200,000 was just way above.
We give a blanket number that we feel is enough to cover what's in the building, based on the best estimates versus a full-blown inventory of depreciated values.
Just to clarify, this does not, y'all do not handle any of the school properties, correct?
No, that's there.
We survey a lot of all kinds of public entities. The schools is a good example of things being forgotten. As an example, Jeremy, we have found athletic centers.
Boosters built a $3 million indoor football field.
Everybody thinks somebody else insured it. And
Didn't cost anything to build it. Oh, my goodness.
And it's like, you make a call and it's never been covered since it was completed.
I talked with the director, he said all these buildings and all boosters they're all on school property now, so that's up to this.
Yeah, I didn't.
Do you want, because we got into a quandary on that, so.
We have a fixed asset list, and I was talking to Kim, we've done it before. We can send her a list of our fixed assets to compare to Bob and Jeremy's list, and Brittany's to make sure it's correct. And then if you want to, at that point, would you, then after we do the, where she does the comparison, we could have Jeremy send it to everybody. Would that be the easiest? That way we make sure we've accounted for everything that we know about. And we've done that before because it came up, I did it a couple years back, and that's when the Hendersonville Library came up, because I was questioning why we weren't sure part of it. So we do look at those things, and the courthouse came up last time for the value because we ended up suring it quite a significant number because we didn't have a final number, and we got concerned about it.
That was one that fell through the cracks.
Well, not on, no, somebody released them before we were aware of it, yeah. When we become aware of it, she immediately contacted Bob and him. And then there's a certain period of time, I think, is it 8 weeks or something, it's covered anyway, or that's what somebody was.
It's gonna be dependent on insurance policy, but.
There's a certain grace period, but I'm not sure how.
When you build a new building, most people just take what they spent on the building to carry them over until they actually figure out, because like that building, there's lots of stuff on there that's not covered, and there's no reason to pay premium on a building value that you could never get payback for. So, like the value of the land is irrelevant. A tornado is not gonna steal your land. It's gonna knock down all the stuff that's on it. So like the blasting to move the ground is irrelevant. It's not covered. No reason. And a lot of times stuff underground is not covered either. So just to be safe, we'll just use what you spent until we can get and actually do an analysis. And that was a heck of a building you guys built.
They're still building.
There are confused people all over the country that I talk to about that building.
Where's, you know, and we know it's still being built, I guess is a good word for it.
And Mr. Chairman, I might, again, just for the new folks on the committee, about the structure and how we fit in. Many years ago, when I started this company, I did a lot of this myself, and then time set in, and we grew, and so now we have split into property and casualty on one side and benefits on the other side. So Jeremy's president of RAI, which is a division that does all kinds of property and casualty things, and then Brittany is the president and CEO of the benefits side. So they're all quite complex, and so we've got some great minds.
So you don't do anything?
I was hoping you would notice that, Earl. I wish, but the only way you can learn something is to mess it up and have failures and learn from them. So sometimes I may see it a different way, but I keep my mouth shut and let them figure it out. As long as it's not going to hurt somebody or bankrupt somebody, but I've never had that situation come up. But I got all the trust in the world in these two people, and so do many of your other public entities around the state. We only operate in the state of Tennessee, so.
Just to throw it out there, since we are meeting on the 7th of May, could we just get those lists and just make sure that we're all good to go? That would just hopefully not take very long, and we can concentrate more on the benefits side, but just to mop that up, get it off the agenda, because right now I still see it's probably on old business until we finally say we're done. We haven't got this covered.
We have a reporting process for new equipment and for new buildings, but we have in the past in our list to compare, and that's, I don't know, isn't it something you buy?
Change that up drastically every year, so that part.
You know, the last time we changed it, the only question I had was the Hendersonville Library, that's all that about. So we do compare them.
Since we're on old business, the insurance coverage on the one-to-one equipment, do we want to keep that old business, or?
Yeah,
till
I get with the direct language.
Okay.
It's on here.
Can I ask a question about that?
Sure.
How much equipment are you talking about? How much is the month, do you know how much money it is?
There's at least an x-ray machine over there.
Yeah.
And
So-
everything else.
I mean, computers, exam tables,
Do you have a general number, like total, $1 million, $5 million?
I don't have numbers.
One thing.
I sent them a list of everything.
Seven clinics and we don't have the buildings.
They have,
And that's spread across how many locations?
How much inventory do we carry over there?
Yeah, do you have an inventory list of each? Okay.
of like the stock
Yeah.
of everything,
It's
yes,
about what,
it's been
each location or total?
We broke it down by location, with, like, for instance, Hendersonville is a lot larger than White House, so it was done by location instead of.
There's also some
Supplies and drugs in there, it's a good thing to have as that inventory. Whenever we talk.
If I could give you a question to ask, if you have an opportunity, might be, since they decided to wait until July 1, budget year, question might be to ask, is your current carrier willing to cover it? It's pretty specialized equipment. It's not like insuring a stove and a cafeteria.
But the supplies and drugs, I mean, that's a
So,
good deal.
you know, maybe that they need to bid it out and find somebody who will cover. I don't, it could be a lot deeper than just, we're gonna wait till the next budget. And I'm only saying this because if I see something glaring, I feel like I need to speak up. Even if you fire me or whatever, you don't have to like what I said, but I feel obligated to do that. And it's selfish because if I don't speak up and that building blows down and the county, it's all county money, has to replace it, you're gonna ask me why I didn't say something, or we didn't say something, so that's why I was so kind of dogmatic about it, but I think it's important. And we do carry insurance for not speaking up. But I don't want to spend it.
Yeah.
Because they usually can't see policy on your first claim, so.
Okay, so I think we got that taken care of now.
I mean, I don't have to.
I mean, I don't wanna put you on the spot or anything.
I'm available whenever you.
I understand, appreciate it, Jeremy, just let you go back there and be comfortable. So I'll bring us back under rules, and we'll move on to new business. Possible update to the occupational compensation plan.
If I may,
Go ahead.
this is probably gonna need to roll to old business so that you all can review, but basically what's happened is under section 3, specifically 3-302, limitation of time, we've got an issue where, we say we're gonna close a file down if there's been no medical attention for a period of 6 months from the date of the last medical treatment. What we've got now is a school board one that we're still carrying that has been reduced down to annual visits, and instead of turning it into something that costs more, we're gonna need to look at amending that section so that we don't necessarily close them down at that 6-month interval and let them run the annual checkup so that we're not incurring additional costs, because we still have to carry them anyway. So that's what we're proposing to do. I don't have any language, I just wanted this committee an opportunity to review it, if they had any suggestions, and I can have some stuff prepared for the next meeting in May. And I guess I'll email in case you don't have it. Do you have this on?
It's on the website.
Is it? Okay. It's on the website, and I'll try to get a copy emailed to everybody as well.
Okay. Insurance rates.
And these are start on page 30, and they are based on the all-in rates sent from Blue Cross Blue Shield, the actuarials from Mr. Thornquist for the clinics, and the calculations for the local cost. Right now, in a nutshell, the things required to keep the funds, healthy and the same would be 5% increase on health, 0% on dental, and 0% on OJI based on the current trends and liability. If you look on page number 30, I'll go through the documents I provided through your analysis. Page 30 is just all three of the programs combined together, and there's several summary pages, but if you look from right to left at the third column over where it says 25, and this is based on the budgeted estimates. If you look at the very first number, 17.7 million, and you look at the very bottom number, 17.5, with the 5% increase, that's a conservative estimate of where your health insurance fund would be, and I think it would actually break even. So mine is right now, and that's what's built into the budget currently, is my recommendation would be to run with the 5% health insurance increase. If you look at the next one, and you look at the 1.3 some odd million, that's your dental. And you look at the bottom, the estimated based on the all-in rates and everything's about 1.5 million, would actually show a pickup with a zero increase because the dental, if anything, the cost has been going down, which makes no sense. I guess negotiations from Blue Cross. And the next one, based with the discussions with the law director and seeing the current trends, would be your on-the-job injury and liability. If you look at, would be $5,037,000 some odd dollars. The S&P 5,281,000, which is actually an increase, so I wouldn't recommend a premium increase for that one this year. But I strongly recommend looking at one next year because that amount's going down. But my recommendations right now is 5% health, zero dental increase, and zero for on-the-job injury and liability. That is for the portion in this fund for claims, not for the actual reinsurance, because they'll be quoted from Kim's office, and they're usually significantly more than that. And I can go through each individual page if you want me to, and I've even got back in here 10-year trends. So these first several pages will actually be from page 30 through
56. 55.
Not that part of the trends. 30 through, some of those are 10-year trends that we put in there too.
Just a question, on these other sources that were carried in 2022, 2023, and weren't this year, other sources, you guys noticed, it's on.
That's in the past, that's when the schools had it. They're a small number, correct?
Yeah.
Okay, I know what you're looking at.
I just saw that on a few of these pages.
So what happened in the past is that the county's health plan and the school's classified employees were under one health plan. So when we did that, you have to do an actuarial for OPEB. In other words, it stands for other post-employment benefits. That's for your retirees insurance. You have to do a full actuarial each year and an update at least every year in between. So you have to do one every 2 years. In the past, us and the schools did that together, and they reimbursed us. Because we completely separated, we're doing our own studies now, so they won't be reimbursed us, so we won't be incurring the cost. So it won't be flowing through there. And then there's a large increase that helped cover some of your costs this year, and it was even, I brought down the rates for next year conservatively, interest earnings. You're earning quite a bit of interest earnings right now. But I wouldn't recommend any more than 5% because we've been using the estimated all-ins with Blue Cross. They're very conservative, and we've been picking up a lot of cash. So I think even with 5%, there's a probability you're going to pick up some cash, a small amount. And dental, it's a small plan, and with no increase the last several years, we've been picking up cash. And the on-job injury and liability has been doing good since we split off from the schools. We think it's actually running better. So we think it'll level out next year, and it'll have to start increasing it again. But I think with the schools dropping out, by your 70s and 0 years. Because I think the county and the highways portion is more than covering it right now. And we dropped out the schools. The only thing we're covering for schools is the write-off ones right now. Does anybody have any questions? The first several pages are the ones that will actually be in your, if approved today, will be in the budget doc. And following though, there's actually 10-year trends that was asked about from Ms. Boyd. So those won't be in the budget document, but we did print out the last 10 years of claims for all the funds following through page 55.
Anybody have any questions?
It would need a vote for the rates.
Okay. So we're recommending 5%.
5% health, 0 dental, and 0 for OJI liability for the portion in this fund. And then Ms. Kim will provide the estimates for the amount that's paid for the reinsurance through the general fund and the highway fund. So it'll be separate from this.
So everybody's good. So we'll go ahead and have, so move on those.
I'll second here.
Those in favor?
Aye.
Those opposed? What about the admin rate?
Page 56, and let me go through the first ones. You have a couple admin rates, and I haven't included a couple of them because they didn't change. The first one, you have inside your health a vision plan that's part of your health, and it has 80 cents admin fee per month per plan, and it's recommended to be the same for Blue Cross Blue Shield, so there's really no action unless you want to inquire from Blue Cross Blue Shield. And then your dental has $4.25 PSPM, and that's the same this year and last year, so there's really no change unless you guys want to discuss it with Blue Cross Blue Shield. But the ones included in your packet that you will need to look at on page 56 through 59, and there's two different options they sent us. On page 46, there's the first one for a 1-year option of $45.59 per month, and then on page 58, there's a 3-year option. If you do take the 3-year option, if you read down in the conditions, if you terminate early, you do have to pay for 1 month's extra fee, so you do need to be aware of that. And I think last time, before this, a couple of times back, we did not look at the multi-year because we were looking at possibly separating out the prescription, but I think because of state statutes right now, we've kind of dropped back on that for a while.
I mean, I was looking at that, I mean, $2 rise in 3 years, that's pretty good.
On the multi-year.
Yeah.
Currently, what you're paying is, let me tell you what our current rate is, which is important. Our current rate right now is $44.70 per month for health from Blue Cross Blue Shield. They're recommending $45.59 for the 1 year if you take it, or $44.51 if you take the multi-year for the coming year, which would actually be slightly less if you take a multi-year than what we're paying in this current year. So it requires you to take a 3-year commitment, or forfeit 1 month of administrative costs, I think, is the forfeiture, which is on the bottom of page 58. If Sumner County Government Self-Insurance Board terminates prior to the end of the multi-year fee agreement to 27, there's an early termination penalty equal to 1 month's fee. So you can still get out, but you have to pay 1 month's fee.
So, how long have we been with Blue Cross Blue Shield?
Many years.
That kind of solves the problem.
You look at Blue Cross, or there's a few other large carriers, but
I mean, to me, this would probably be the best thing to do, at least try and save money.
and we did a cost comparison 2 years ago. We got the actuarials involved, maybe a little longer. Maybe a little longer than that.
I think it's been a while. It's been a while since we've done, yeah.
We get basically involved in actuarial going out and getting their contracts and trying to run the data back through and compare it with other carriers. That is one of your options because your administration fees are not your big driver, it's your claim.
It's not. The big driver of your entire health plan is your claims. That's really where it's at. So if you really want to look at what the cost is, it's really doing a claims analysis, which we don't have enough time for 7-1. If you want to look at doing a claims analysis, we need to plan ahead for the next year. So yes, it is important, and I'll tell you, you are a fiduciary. You're responsible for using the money of the county appropriately and making sure that you're making correct decisions. Yes, there are, lawsuits that are coming up. People are not being appropriate fiduciaries of plans. But it does come down that it is up to you. Administratively speaking, though, this is the smallest part of your entire plan cost.
And you've got to think about it this way. Your smallest cost is your administrative cost. What's important is the contract discount. So if we save, or you guys save $30,000 on administrative cost, easily one contract discount on a large claim could cover that, or several small ones, or 10 times that much. So that's why you need the actuarial. They actually need to see the contract discounts based on their claims, not unless you're just unhappy with Blue Cross's administration. And I'm sure anybody can find fault with any of the plans, they're not gonna like something they don't cover, whatever, but by and large, we hear very few complaints about Blue Cross. We hear complaints of things that aren't covered, but a lot of that's what you guys are willing to cover, not Blue Cross, not their actual
And
administration.
your plan, by and large, covers more than many plans outside of a public entity. I mean, like, or you cover pretty much everything. You have a very thick benefit, a very rich benefit. I will also say that I think that no matter what Blue Cross might try to sell you, or Cigna tries to sell you, or Aetna tries to sell you, or whatever, in the end, I really do think that discount-wise, I don't think that that's where the healthcare industry is headed. They will talk to their all blue in the face that they have the best discounts, and I just don't think that's where it's headed. Where it's headed is that we're going to start finding out what stuff actually costs, and that's what we're going to be paying. So this is a dying breed. I'm so sorry. Discounts are the dying breed, not the TPA, not the insurance companies. That let me be very clear. I think what we're moving towards is the fact that you're going to find out that your surgery costs $10,000, and you're going to write a check for $10,000, or you're going to be covered for this much, and then you're going to have to cover this. Or if you go to Blue Cross, it's only going to cost you $500, but hey, you're going to know how much it really actually costs. That's where we're actually going, not this like, everybody knows. It's not the Wizard of Oz. We're leaving that.
I've been a proponent of that for a long time, but.
Yes, exactly. So.
Having a menu of.
Correct.
All services.
Exactly. To be able to Google shop it, yes.
And there's another part, if you do change carriers, and you're not got a significant change, you've always got to think about this, right now it's a hard time to necessarily get employees in some instances and other things. No matter what other plan we take, there's going to be some differences, so you're going to have some employees that are happy because they picked up something, and a lot that's going to be unhappy because it's a little bit of different coverage. They got to change pharmacies and doctors, so if you don't get at least enough of savings to make your difference, you're going to disregard your employee base.
I've been under Aetna, Cigna, Prudential, and Blue Cross. I've been under all four. Now I'm under TRICARE.
So every time you change, you'll cover something a little different. Your doctor's got to grab your card, and you may not take your doctor.
So I know, ins and outs of a lot of them and all that, what we prefer, but,
unless you're planning to change before 2027, your best deal is a multi-year, unless you're looking to change carriers before 2027.
I just add one more component to that. You mentioned that claims are the most important thing, addressing claims. Inside that is chronic claims, which is where the majority of your dollars go, and you're addressing that and have for years with your clinics and wellness and so forth. So you have a good handle on that. What's changed in the last 5 years is your total all-in cost, the percentage of RX of that total all-in cost is continued to, it's a steep climb. And we're seeing accounts that over 50% of their total spend is on drugs. That used to be 17%.
We try to break it out.
So we are still monitoring the drug issue, the RX issue, and we're hopeful that politics will change or whatever, and we can get back to a sane look at what we did for some of our clients prior to the state legislature taking the actions they did, and get back on the road to doing that. And again, what that entails is you carve out your RX from your medical plan, whoever that carrier is. It may be the same. In other words, you bid it and let everybody bid, but you need to get rid of the smoke and mirrors of the RX and the PBMs and the drug manufacturers because of the discounts and all kinds of fancy words. They're still gigging you. So until you can get it down to what Brittany is addressing, which is like on your medical procedure, where can I get this done the best at the best price, and not just some global thing. You can do that with drugs. We've already done it. We proved it. And the state legislature stepped in and said, don't do that. And we know probably how that happened. It all has to do with money. But we're still working on it. And at some point, you would need the flexibility if you decide, after we're looking at it like you did the stop loss, employees don't even, it doesn't bother them.
I do have one question about that. Hey, Scott, if they ever were to carve out RX, does it ruin the entire multi-year, or do they just pay a PECM fee?
I've tried to get clarification.
Okay. Okay, thank you. I just wanted to clarify. I know something happened.
The current agreement, this is actually the third year of the 3-year agreement.
That's what I thought, yeah.
Did not stipulate,
What? Okay, all right. And I don't see it.
yeah, I'm.
In your paperwork? Okay, cool. Thank you.
It's just good that you all know that and have that flexibility. We gotta get through an election, and I think there will be a different view, regardless of what happens. I think there's gonna be a different view, and we'll have a, we will right back into the state legislature.
State legislators, that name is these plans, what's going to do. They cost you guys a lot of money.
Yes, they have.
They went to this small pharmacy protection statute that really didn't do that, just drove up
That's a
costs.
whole nother hour.
Basically, largely benefited all the PBMs that were making a ton of money.
Which is why you guys have got even 5%, because we probably wouldn't be looking at that if they hadn't done that.
Just to give you an example, another client we had, 1 year, no change in benefits, there was $500,000 difference in cost. That's a pretty large account, but still, yeah, there's dollars there, and it's mostly in generic because of volume. You look at your, how much generic you're doing, how much other.
It's all, so just basically, nothing is really super stable in that market right now. It is stable in that you can get your medications and so forth, don't let me scare you, but as far as making money, those folks are not super stable right now. People are figuring out that actually if I don't run it through my insurance and I use a discount card, it's a whole lot cheaper and I can get actually 90 days. That's not right. And so people are starting to ask questions, and as different generations start to take over and start asking really hard questions and start pushing things to get changed, I think we're going to start seeing more and more of a topple effect. We are starting to see large insurance companies go, well, maybe discounts aren't the way we need to go. Maybe we do need to actually do direct negotiations with hospitals or with procedures. Maybe we do need to have, so things are changing. Things we never thought would occur are occurring. There used to not be discounts. That used to not be how insurance even worked. PPO was not even a thing. So even though that might be how it's been since you were a child, or maybe you've even seen it, change over your years, just remember it's always evolving. Business is always evolving. So anyway, I'm the 3-year with Blue Cross. It's been stable. They're very responsive. Your account executive is very responsive and gets things done. And all of that is great. I think the one kicker is I want to make sure. So right now, if you were to remove RX at any point, it doesn't change your contract. That's the way that it has existed so far in the past 3 years. I would like for that to remain for the future 3 years. The thing that they have said clearly is that there would be like a PEPM, but even the discount would have, or the cost avoidance would have overshadowed that PEPM. So that's the one caveat that I would like to remain in that contract. But I don't see any major red flags about remaining with Blue Cross for 3 years.
Could you approve contingent upon that they do that?
You want a motion?
Yeah. Could you approve it contingent upon that they do they carve out the prescription, that we can remove it, like the old contract? Basically, it allowed us to remove the prescription drug in the old one.
Motion on the floor.
If they don't,
I'll second your motion. Before you do that, I would ask, what are you gonna do if they don't?
I'm gonna go with the 1 year. If they don't, then we.
Are you gonna shop then, or you just still gonna commit? So if we're gonna end up in the same place either way, I'd ask for it, but I wouldn't make contingent.
They don't think you could do it 1 year if they want to do a change. That would give you the option.
Okay, so yes, we will do the 1 year then.
Because the 1 year would allow you the next year to do carve it out, which you would be under a claim. You could actually shop too. We could go back and do the actual work.
And we need 6 months more at least to shop. You're too close to the
now, if they do the 3-year contingent on Blue Cross doing it, if they do, they take the 3 years. If they don't, they take the 1 year, then that will allow them during this year, the next 2-3 months, decide if they want to go do an actual on Blue Cross, if they want to divide it up, which I wouldn't foresee them all divide it up. But they give them the option, that's what Eric's question was, what if they don't take it, what do you want to do?
So that's, we'll go multi, if they don't do the carve out, then we'll go single year, that's the motion, so take.
I'm still with you, I'm saying.
All in favor?
Aye.
All opposed, no. Okay, let's see. Okay, we got everything taken care of. Motion to adjourn.
So moved.
I don't know,